Hi everybody, Dr. Garcia from Garcia Facial Plastic Surgery. Today I'm going to be talking to you about your post-surgical instructions with regards to blepharoplasty. Blepharoplasty is eyelid surgery. Whether you have had the upper and lower blepharoplasty procedure together, or whether you have had just the upper or just the lower, these instructions apply to you. The first part of this is what to do the day of your procedure. When you get discharged from our facility, we're going to instruct you on using cold compresses, and this is exactly what you're going to be doing the first night of the procedure. You take a gauze like this and you soak it in ice water. After you soak it in ice water, you wring it out so that there's no excess water on it, and then fluff it up just a little bit. And then you take this cold compress and you put it right into the eye socket, just like this. Let this sit in place for about 10 to 15 minutes and then replace it. You can use the same gauze, soaked back in the ice water, wring it out, and then just keep replacing it back and forth. We want you to do this as often as possible the first night after surgery. You can continue to do this for a couple of days after surgery. This will help with swelling and with bruising, but it's very important that this is how you apply the cold compresses to the eyes. The day after the procedure is when you're going to start doing your cleanings. The first part of the cleanings is using the hydrogen peroxide on the incision lines 6 times a day. You take the Q-tip, you soak it into the hydrogen peroxide, you close the eyes, and you clean the incisions on the upper, just like this, along the axis of the incision, or if it's on the lowers, just like this, along the axis of the incision on the lower eyelid incision. So this is for either procedure, but we want you to clean with the hydrogen peroxide 6 times a day. After you clean with the hydrogen peroxide, you take the lubricating ointment, which you have purchased at the pharmacy. This one here happens to be Sustain. There's many different brands that you can purchase. As long as it's a lubricating eye ointment, you can use this ointment, and all you do is put a little bit onto the Q-tip and then you apply it along the axis of each incision. This is what's going to keep those incisions moist. Again, we want you to do that 6 times a day. The ointment can also be used inside the eye for moisturization purposes. So this ointment, before you go to bed at night, can actually be put in the eye to help you retain moisture in the eye, and you can do that prior to going to sleep in the evening. In addition to that, you can use lubricating eye drops. If you want to purchase some lubricating eye drops, you can use those inside the eye for the first few days after the procedure. That will help with dry and itchy eyes. On the day after the procedure, we want you to take a shower, we want you to rinse your hair, and we want you to clean your hair once a day with the baby shampoo. This is what we want you to wash your hair with for those first 7 days after the procedure. All right. We also want you to clean your face with Cetaphil soap. Cetaphil is 3 times a day. All right. We want you to wash your face 3 times a day with Cetaphil soap, at least for the first 7 days after the procedure. You can use the liquid soap. You can also use the bar soap. The last few bits of instruction are with regards to makeup. We don't want you to apply makeup, that's mascara, eyeliner, or eyeshadow, for the first 2 weeks after surgery. The other thing is we don't want you to wear contact lenses for at least 2 weeks after surgery. And the final thing is we do not want you to pluck your eyebrows for at least 2 weeks after surgery. So here are the instructions for the first few days after blepharoplasty procedure. Thank you for watching.